Hey everybody, this is Dr. Joe Borio with this week's Thought Flash. First announcement is our next event. It's going to be a life-changing event as always. It is going to be awesome. It's going to be in Philadelphia, and it's May 13th and 14th, which means it's coming up this weekend. And we're going to start Friday around 5-ish, and we'll go probably till 9, and then we're going to go all day on Saturday. I hope you guys can join us. It is going to be phenomenal, exciting. We're going to talk about technique, we're going to talk about the art, we're going to talk about the philosophy, we're going to talk about the science. We've got Dr. Tom Colton coming in, who's a functional neurologist. He'll be speaking on the neurology of chiropractic and the neurology of the body and what's right about chiropractic. Phenomenal stuff. We're going to have Dr. Pete Lombardi, who's part of Chiropractic Consulting, one of our coaches. He's going to be joined with us on Friday, and he'll be leading the event for us on Friday. So it's going to be really exciting. I really want to see everybody there. I have so many chiropractors all over the country, from Australia, from England, from Canada, and they're emailing me and they're calling me and they're asking me questions. And I tell these guys, listen, I'll give you some info, but join us at one of the events. Join us and become part of our family. Really take the commitment. If that's what you want to be, a great chiropractor, principle-based chiropractor, if you want to enjoy seeing more people, seeing more families, converting more people, getting people to understand what it is we do and how vitally important it is for them to make chiropractic the part of their life and part of their family's life, part of their children's lives, that's what we teach you. And I still go to work every day and still very much enjoy what I do as a practitioner, and I love it. Okay, that being said, happy Mother's Day to all those moms, and hopefully you're having a great day with your families and your children and so forth. We want to talk a little bit today about some more aspects of what we do in the office and try to explain to them what it is you do as a chiropractor. I think we forget how absolutely vital it is to have good communication when it comes to longevity of care. Patients, if you will, are members of your practice, members of that healthcare family that you're trying to develop. They don't understand what it is you do, ever. We talked about that a couple of weeks ago. They never get it. But in order for them to have some basic understanding of what it is you do, I like to use props. I talked about forceps, I talked about a baby, I talked about a telephone wire, a garden hose. Sometimes I feel like Carrot Top on my Monday night. But the vertebrae, I have a model of teeth to show them the example between straightening teeth and straightening the vertebrae. We have books that we share with them. And we have a slideshow presentation that has little movies and other examples. I don't think I can explain enough how important that is. I remember watching Dr. Joe Felicia's Monday night, which I still have a copy of on a VCR tape, and that is just awesome, Renaissance. And he had so many different props, if you will, or educational tools to help people really understand what it was chiropractic did. And what I love about those is they're on a shelf right near my 4 adjusting room. So at any point, if a patient questions their care, I could go over their x-rays with a touch of my screen, because their x-rays are on we use a ChiroTouch system in our office, so I could show them their x-rays with a touch of our screen. I can grab one of my models, I can grab some of those educational tools, the electrical wires, which I use all day long. I probably pull that out 10 to 15 times a day. We bring out the model of the teeth, we pull out the 4 phases of decay, and then we have the autonomic nerve chart. We're doing 30-second drill. So, when you go to work every day, I think so much a part of what we do is teaching, and you have to be ready to teach. And you have the opportunity to teach people every day when you put your hands on them. And when you approach that room, you could say, "Hi, Linda, good to see you." Don't ask them how they're doing, not to be mean, but you're focused on correcting their spine, not treating symptoms. A great way to word it is expression, as Dee Dee and BJ always talked about. Medicine really teaches the expression of disease. The expression of disease is the symptoms. And what you do is you adjust the patient to allow them to express health, to express normal neurology of the body. And it's so exciting. That's why I'm so excited to have Dr. Tom Colton with us this weekend, because he's going to talk about the neurology of what we do as chiropractors. We have to understand that the neurology, the input, the afferent efferent of the spine is nutrition to the brain. And knowing that, we know that the largest number of sensory receptors are placed within the spine. So by adjusting the spine, the adjustment itself creates nutrition to the brain through neurology. Number two, by having an individual to have a healthy spine, their spine moves at all segments, and therefore they get proper nutrition from each vertebral segment into the brain. Therefore, the sympathetics are working properly at the right level, not too much, and the parasympathetics are working. So we really have a true expression of health. We have a true expression of homeostasis. That's what it is you're doing as a chiropractor. I mean, and it's so much more than that. It's so absolutely exciting when you read about serum thiol levels and how it improves the DNA replication. When you read about these studies on osteoporosis now, they're doing studies on osteoporosis in the adrenal gland and how the adjustment allows proper balance of the adrenal corticosteroids from the adrenal gland, and therefore allows proper bone density. I mean, that's exciting stuff. There's research out of the Journal of Orthopedic Surgery talking about bronchitis and asthma, and how they had chiropractors treat patients in those areas of the spine that had vertebral misalignment. I mean, it's written as if D.D. or B.J. Palmer wrote it. It's amazing stuff. It really is a great time. It's an exciting time to be a chiropractor, and unfortunately, I see too many chiropractors abandoning it. I understand why. It's tough. It's tough to stick to those principles of chiropractic because you're challenged every day. So the way you stand tall and stand on granite is you got to know your science. I'll tell you, science gives you a level of certainty that is incredible. And then if you know your philosophy, that really gives you your purpose. So knowing your philosophy gives you a purpose. It gives you a mission, which motivates you to do your science, your studies of science, and reading a little bit every day and watching. My God, YouTube. Every mentor, every coach has got a few minutes on YouTube. Great stuff. I watch everybody as well. There's a lot of great. Bruce Lipton, who's a geneticist, talks about the expression of DNA and RNA and the expression of genetics and human health potential. It's just amazing stuff. So there's so much stuff out there to really dip yourself into and get charged up, fired up with what we do as chiropractors. We're going to be doing that this weekend in Philadelphia. I've got a lot of new people that signed up. I'm really hoping this week pushes a lot more in there. I'll tell you, I am still amazed at the number of people who want a big practice and who will complain all day about how difficult practice is, but they won't take the initiative, which means doing the right thing without being told. They won't take the initiative to improve themselves, which in turn will improve their practice. That's what I do. Dr. Pete Lombardi and myself, we practice. We still practice every day, even though we coach people. I bring my staff, Leanne Klein, who's absolutely phenomenal. She's been my office manager, and she's been part of our practice for 15 years. You get to rub elbows with them. You get to rub elbows with my staff who are sitting there. We've seen days over 600 people in a day. I mean, that's just incredible. And it's just a great practice. It's a great place to be, and you're learning from somebody who still does it every day. What I tell you to do, I still do every day. I'd love to have you part of it this weekend, and I would very much enjoy having you part of Chiropractic Consulting in our family. We've got so many great clients, great members of our Chiropractic Consulting program. I'd love for you to meet them, talk to them, see what changes they're going through in their life and in their practice. I'd love you to be part of that as well. Listen, on this great Mom's Day, make sure you give Mom a call, give her a hug, tell her how much you love her, and thank her for all the wonderful things she's done. If not, she's not with you anymore, certainly say a prayer because you know she's with us. Awesome place of universal intelligence. Guys, it's been Dr. Joe Borio, Chiropractic Consulting. Remember to get out, love what you do, serve the members of your practice, enjoy what you do, get excited about what you do. That's what people want to know. They want to see that you're excited, that you're passionate, that you're part of it. And if you're willing to stand tall, they'll be willing to stand tall. You'll create some great warriors in your practice. Have a wonderful week serving, and I'll talk to you guys next week.
My best friend gave me the